Hello and welcome to this short video on how to dilute sodium bicarbonate for use. So sodium bicarbonate, we're noticing that's taking a larger role in therapy with what we're doing in shared health. I'm not going to get into the medication specifically itself for this slide, but you do have to acknowledge that this medication is considered a high alert medication. So when administering this medication, not only do we have to do our patient rights of med administration, we have to also make sure that we are double checking any math indication, contraindications with our partners to make sure that we are giving this medication appropriately and correctly. So indications, again, much more extended now. So we are looking at using sodium bicarb for TCA overdose, cocaine toxicity in cardiac arrest, metabolic acidosis due to prolonged cardiac arrest, sodium channel blocker toxicity, and beta blocker toxicity. And we're also using it for treatment of hyperkalemia. So there's a lot of different reasons now. So with that, when we give this medication to adults and or adolescents, we're looking at the 8.4% concentration. So that's usually how it's issued to us. We get them in the jar here, sometimes as preloads. But again, just because it is a high alert medication, we want to make sure we're always checking the labels that we're using the right concentration. So in the vial here that we're getting, we get 50 milliequivalents per 50 mLs, which equates to 1 milliequivalent per 1 ml. So when we're doing our math, that's pretty straightforward. When it comes to infants and children, so basically anybody under 10, because a child for shared health is considered 1 to 10. So 10 and under, we're going to be using a 4.2% concentration, not the 8.4. So what this means is we're going to need to dilute the 8.4% with sterile water because we do not have a 4.2% concentration available to us right now. So why do we need to dilute it? Why can't we give the 8.4% to pediatric patients? The first one is just hypernatremia. We can just cause too much of a sodium imbalance, so their sodium will be too high. We can also increase the osmolarity of their fluids. So with that, when they have that level, the body fluids have a higher concentration of solutes compared to what is normal baseline. So that's basically the definition. The big thing is in pediatrics, the increase in sodium toxicity causes the movement of water across cell membranes, causing cellular dehydration. So this causes decreased cellular volume as a result of water leaving from the cells to maintain equal osmolarity inside and outside the cells. Now the problem is the brain cells in pediatrics are especially vulnerable to complications resulting from cell contraction with that sudden fluid shift outside of the cells. So we look at severe hypernatremia. Usually in pediatrics, it comes from dehydration, but if we give too much sodium bicarb too fast, that rapid excess sodium infusion can induce brain shrinkage, which can actually tear cerebral blood vessels, leading to cerebral hemorrhage, seizures, paralysis, and encephalopathy. So with that, we're going to dilute it. So it's not such a high level of sodium. The other reason we dilute it, it'll hopefully minimize that hyperosmolarity like I was talking about. And also we're going to be pushing it slower because there's more fluid, so it's going to take a little bit longer. And that'll help reduce that rapid fluid shifting, causing that issues with the patient's brain. So the first thing we're going to do when we get ready to give our sodium bicarb, we get our supplies. So we get our sodium bicarb. That's kind of a big one. We're going to get our vial adapter, so it's easier to draw out of the ampule. We're going to get a 50 cc syringe. If you choose to, you can use a blunt, and we'll talk more about that later. And we're going to need sterile water. So first things first, we're going to have to figure out how much sodium bicarb to give our patient. So let's say you have a 4-year-old that has a suspected acidosis due to prolonged cardiac arrest. So what we're going to figure out first is the patient's weight. So let's say your 40-year-old is about 35 pounds based on parent information. We're going to divide that by 2.2 to get our kilograms. So it basically gets your patient to 16 kilograms. It's 15.9. I'll just round it off to 16. So that is our patient weight we are working with. As per our med guidelines, we're going to do 16. So we have the choice of doing 0.5 milliequivalents per kg or 1 milliequivalent per kg. So I'm just doing the 1 milliequivalent per kg. So 16 times 1. So I'm going to give 16 mLs of the 8.4 bicarb. So as you can see here, it's 1 milliequivalent per ml. So 16 milliequivalents, 16 kilograms equals 16 milliequivalents equals 16 mLs. So we're going to draw up our bicarb now. So basically, you just confirm you got the right medication, you got your dosage confirmed by your partner. We're just going to spike our vial, and we're going to draw up our 16 mLs. Okay. Now that we've got 16 mLs of bicarb, we're going to draw the equivalent amount of sterile water to match the fluid amount of the sodium bicarb. So again, you have to make sure you use sterile water for this. We don't want to use saline because we're already putting sodium into the patient with the sodium bicarb, and we don't need to give more salt than we want. So we're going to dilute it with sterile water. So we take our sterile water, we take our syringe with our bicarb. So you can either use a blunt. I use the vial adapter just because it is quicker to drop a lot of fluid. So it's at your discretion there which one you want to use. And we're going to drop 16 mLs of sterile water. So we should have 32 mLs in total. And this will give you a concentration of 0.5 milliequivalents per ml concentration. And now that you got your concentration of sodium bicarb and your dosing confirmed, you can administer your medication. In cardiac arrest, this can be a rapid fluid push. In non-cardiac arrest cases of giving sodium bicarb, we're going to administer it a bit slower. We're going to give it over 2 to 5 minutes. And that is dilution administration of sodium bicarbonate. Thank you very much.